Hello, dear colleagues, and we continue our course about intelligent based clinical decision support systems. And today we'll talk about chronological scales related to the time frames of the research we're providing with our patients and so on. We also need to address the significance of the challenges related to the time representation when dealing with medical data that will be changing over time. And today we'll try to explain why medical data is well represented in the form of chronological scales and determine the time frame of interest for clinical trial questions and determine the time frame in which different data is presented. And we will explain the difference between explicit and implicit representation of time, describe at least one problem related to the temporal classification of impacts and outcomes, and we will describe non-stationarily and explain why it's important that our medical services are non-stationary. So, of course, we all understand that we all exist in time, and all the data on medical services and procedures as well will be related to some time characteristics, time parameters, and in order to combine this data into something understandable, a complete picture of what's happening right now and happened before, we will face the task to integrate heterogeneous data obtained from different sources and its time frames. So a good way to integrate all the different sources and types of patient data is to synchronize events by placing them on a timeline. The chronological scale is individual and not only for patients, but also for all type of events we're tracking. So a chronological scale clearly will be recording when exactly the patient experienced certain type of procedures, events, and so on. So time requires a serious attitude for two main reasons. A patient's age is a key factor in deciding whether to treat them. A correct assessment of cause and effect relationships requires checking the sequence of events. The time frame required to answer medical questions can be of varying scales and span many orders of magnitude. We may need to consider intervals of a fraction of a second or consider events through the patient's lifetime in general. When choosing the time frame and the way time is represented, it's important to take into account the fact that not only do patients change over the time, but also the healthcare system will change and undergo serious changes, and there will be lots of developments in this system. So the meaning of data elements we're collecting are always a byproduct of everyday medical care, and it will change related to our knowledge. For example, as a consequence of changes in standards of care or improvements in how we record one or another event with different equipment. So when we're collecting data, we can encounter two types of processes. Let's agree to call them stationary and non-stationary processes. A steady-state process is a process that generates data that looks like the same over time. A consistent process is a process that generates data whose distribution of values will change over the time. So this is the main idea why we have non-stationary processes in healthcare. So, depending on the task, the units of time used in healthcare system can span from fractions of a second to centuries. The appropriate time interval directly depends on the disease process itself and the measurements that modern technology can make, as well as one of the organizational features of healthcare system as a whole. So, appropriate time frame depends on a question we want to answer with this time frame. In addition to being influenced by the questions, the appropriate time frame is also often determined by the type of data in the question. Some diseases are classified as chronic diseases. This means that at a certain level of medical development, there is no cure to this disease, and we must fight with this disease possibly for the rest of patient's life. An example of such a chronic disease is diabetes. In our work, we will need to take into account two interacting factors that shape the strategy of our actions: the question and the type of data. When determining the strategy and what inputs into our plan to be used, you need to decide on the answers for the following questions. With what accuracy should functional dependencies be identified? How many different kinds of data are going to be used? How do we know if a patient has a condition of interest? So, given that all processes and events of interest to us take place in time, the question arises: how do we represent time? How can we capture or encode time information in a computer representation? Let's start with a few definitions. A patient feature matrix is a rectangular data frame with a patient in each row and a patient characteristic in each column. The indicator variable tells you which study was ordered, when it was scheduled, but doesn't contain the results of the study. The indicator variable is separated from the study result, which captures the actual values and units of measurement. A time series is a set of measurements and they are sampled at regular intervals, with each dimension being of the same type. In the time series, for example, telemetry or devices that record the patient's vital signs and they are formed into such data frames, they can also store the results of surveys of cell cultures in laboratories. However, it's important to understand that the most significant and critical area of care in which time series data and related analysis methods are being applied is the intensive care units. It's quite obvious that the patient in the intensive care unit is usually in a serious condition. His physiological condition must be constantly monitored with the help of sensors attached to the patient's body. The data streams from the sensors have regular time intervals, and methods from the field of signal processing can carefully be processed using this data. Other medical data isn't collected during regular counting and time control. They are assembled asynchronously as needed. For example, an ECG is a continuous measurement, but blood pressure or blood body temperature is measured as it's being needed. Medical measurements are performed in two steps: prescription of the examination or measurement by the doctor, and it will be next one, actual execution of the study or measurement. So, knowing that an event happened and when it happened, it's a great start, but in many cases, we want to be able to investigate the other forms of events. For example, find patients with events A and B, or patients who have event A and then event B. If events A and B are time cutoffs or short-lived events on the time scale being studied, then the answer to this question isn't difficult. However, if events A and B are, for example, intervals for the presence of disease, things become noticeably more complicated. Let's say event A is pneumonia and event B is rheumatoid arthritis. What does the question patient with A and B mean? Should this disease occur simultaneously? So they will overlap in time, or simply be present as events within the same patient. And what would query patient with A and B mean? In the interpretation, event A must end before event B. In the second interpretation, event A must only start before event B starts and end at any point in time. Most general purpose databases are not structured to make it easier to deal with these differences, but presenting it as a timeline can be much more easier for understanding. So now let's look at how we can get an idea of the time information in the patient feature matrix. First, a quick definition. Functional fixation of a quantity amount, average value, when the corresponding event occurs in a specific time interval is called aggregation or grouping. Let's take a closer look at how it works. Let's start with the patient's chronological scales, or break down the chronological scale into time intervals that are related to the analytics. We call these time intervals cells. According to a number of cells, functional columns in the matrix of patient characteristics are distinguished. Count the number of events of each type that occur in each cell and enter them in the corresponding column in the matrix or characteristics. To choose the dimensions of the time cell, we need to answer a few questions. How many cells do we need to analyze? What is the dimension of time we're interested in? How does this relate to the time frame used in our research question? How do we aggregate or group the data in each cell? The ability to decide how to group data and to work with this group data in each cell depend on the type of event. It may make sense to count the number of events that occurred in each cell. In this case, we can get a zero or positive value. In addition to the quantitative characteristics, this will give us a calculative characteristic, that is the absence or presence of a certain event within the cell. We can calculate the average of all the values in the cell, the maximum or minimum value of all the values in the cell. we might be interested in the very first or last value among all the values in a cell, or the variance of values in a cell. This choice is determined by the research question and the clinical event of interest. We can add an additional function that will capture the rate of change of the function. Creating new features is called feature design. And serious medical knowledge goes a long way toward creating those useful features that will encode time. A cohort in a group of patients who meet certain inclusion criteria usually expose of some kind of situation. Exposure is something that can happen to a patient. The result of a condition of interest that is assessed is having to be occurred to the patient, usually at some point of time after exposure. Overall, we are interested in whether there is an association between exposure and outcome for patient in the cohort. Uh, Therefore, we need to identify those who have been exposed and those who have not been exposed, as well as those who have had a result and those who have not. In addition, it matters when the impact and outcome events occur. Let's say we will record the patient's lifetime and add all the events related to the consumption of any beverage, and the effect of interest will be consumption of coffee. For those who are in the exposure group, that is those who have drunk coffee, the time of onset is not difficult to determine. This is the point in time when the exposure appears on the patient timeline. This time is also called index time. For those who have not been exposed, those so-called those who have not drunk coffee, it's difficult to determine that they have not been exposed. So no such exposure events have been recorded on the patient's timeline. However, how much time should we use if there is a refusal to drink coffee? This is a very important issue and not always easy to resolve. A possible solution is to introduce a proxy event. For example, indirect event such as drinking tea, the presence of which is considered the beginning of no exposure. However, this can change who is in the control group and introduce selection bias. For example, everyone who has not drunk tea or coffee is excluded from the sample. It's important to remember that even if you know that who isn't exposed, it's hard to decide when they should be considered unexposed or not. The next step is to determine the time of the result. We need this to calculate the time of event, which is the difference between the time of the result and the time of exposure. Without a time step of the result, we can't calculate the time until the event. In epidemiology, this condition is called censorship on the right. That is a given point in time where will be some patients who have not yet achieved the result. One possible solution is to use a special code that we will write as T, which means the result has not yet arrived. Another solution is to record the time of the result. If it's already known or the time of the patient last follow-up along the indicator variable to note whether the time relative to the result or the last follow-up was recorded. Careful and correct determination of the time of exposure, the time of occurrence of the result, as well as the dimension of the time cell is necessary when working with processes that develop over time. Along the Along with the choice of timescale and time representation, we must consider the fact that the healthcare system itself evolves over time. Combine these changes make our data generation transparent. Non-stationary Non-stationarity of process is usually a problem, but it's often being ignored. One elaborate way to use machine learning to detect non-stationarity is to remove time as a parameter and then try to predict time from the remaining variables. If we can do this accurately, then there is some pattern in the predictor variables that correlates with time, which means that it's strongly non-stationary. The point of the above is to define the phenomenon, to understand its existence, and to find out what it takes to verify its presence. This phenomenon is practically common for datasets spanning long time intervals and studies with long time frames. So for today it's all. Thank you very much.